Um, on a different note, I wanted to move on and think about this topic. We know healthcare, as we look at the next generation in the next, 10, 20, 30 years, healthcare is going to move more and more out of the hospital and into the hands of people, patients and families as consumers of healthcare, right? And organizations need to think about it, right? Because more and more organizations are now self-insured employers. So it is in their best interest to keep their members healthy and to reduce that cost of care, right? So when we are thinking about that from a palliative care perspective, and you think about employers, you think about insurance companies, um, what what would you want them to know and think about uh, in terms of the support they can provide to their employees who could either be patients or who could end up being caregivers? So what kind of things they should provide?
So I always go back to the toolkit, right? To be able to empower patients and families to even understand the landscape of
Mm-hmm.
what it is they're dealing with. So, I like the fact that Helpsy gives you a potential printout of the points of your illness that are important and need to be followed up on.
Mm-hmm.
I think that helps patients and families to be able to target their actions, in a very meaningful way, as opposed to just thinking the doctor or the nurse is going to be doing all this for us. It gives them also the ability to communicate directly
Mm-hmm.
with their caregiver, and that'll keep them out of the hospital, right? And the more that we do that kind of bedside or at home communication and visits, the less hospitalizations, because people don't want to go back to the hospital. It's not like that's what they want. It's just right now, that's the catchment net.
Mm-hmm.
That's the last resort. And physicians are just so overwhelmed in their offices that their voicemails are just saying, go to the emergency room.
So they go to the emergency room because they're in pain,
Yeah.
Yeah.
and they get the medication they need, and then they're discharged,
Mm-hmm.
and then it happens again. And so, I mean, the ideal method is to have palliative care provided at home
Mm-hmm.
and through telemedicine.
Mm-hmm.
And not necessarily physicians going into the house. The model really would be to have a nurse practitioner be
Mm-hmm.
leading the team
Right.
of work, chaplain, and community volunteers. Because I know Sinai is running a study where they have community volunteers trained to be the boots on the ground in the house, who are then reporting to the nurse practitioner about how the patients are doing, to make sure that they're getting their meals on wheels, that they're getting to their doctor, that the prescriptions have arrived, because these are information that we used to have family members who were home arranging that. But
Right.
now with the shift in demographic, we don't have family members home doing that anymore. So I think the onus is going to be on the health system and the insurance providers to realize that if they can have these friendly visitors who are helping to make sure the patients are getting their ADLs done, that's what's going to keep them out of the hospital. And I think that's what Dr. Morrison at CAPSY's most recent project in New York is. It's proving that if you train, these entry-level caregivers to be able to just assess how the patient is doing on a regular basis, a 10-minute trip to the house just to see, did the meds come? Are your phones active? Did someone shut the lights off? The practical things which result in patients ended up back in the hospital. You prevent the hospitalizations, and the patients are happier because they're in their home.
Yeah.
And you don't want to be in the hospital.
Yeah, you don't want to be.
The patients who are in the hospital, they die sooner.
They die sooner. Yeah. Then they don't feel like it's it's their environment, right? So they are happier at home. Any last words, thoughts that you want to share, reflect on, that you think we haven't covered?
I can't say I think so. I think we did a pretty broad swipe, you know, and benefits and the challenges that face palliative care. You know, there's a lot of work to be done, and we need to expand the workforce. And I think we're not going to get tens of thousands of physicians, so I think we need to, you know, just adopt it takes a village and be able to get more care, boots on the ground at home, to help patients just live the way they want, as opposed to the way they get forced to live when they get stuck into the circuit of the hospital.
I totally agree.
Any last words, Robin?
I just want to thank you so much for bringing this to opening the discussion. I think we need to have a lot of discussions on this. This has to be something that is regularly discussed. I think we also need to become aware of, well, I can feel myself aging, and you start thinking about things, and I think we need to be proactive and start educating ourselves. And the one thing I would like to promote is a website that CAPSI does, which is getpalliativecare.org, and that they have a wealth of information on it as to where to go, what state has great programs, what hospices they would recommend, what got better ratings. I mean, there's a wealth of information on it for the layperson, and I think it's great. And I think we just need to just be more proactive, and because we tend to, when it comes to illness and dying, we want to put our heads in the sand. And unfortunately, at some point, you're going to be faced with it, and so it would be advantageous for you to have these discussions with your family.